in Washington.
You're a co-sponsor of the Medicare for All bill in the House, which says, quote, "It shall be unlawful for a private health insurer to sell health insurance coverage that duplicates the benefits provided under this act." Yet you said on Thursday that you don't support an end to private health insurance in this country. So are you supporting a bill that you don't fully agree with?
Well, I support a bill that would give Medicare to all. That's the title of the bill. The part of the bill that I would strike, and this is part of negotiating and collaborating, would be to give a public option, the Medicare portion, but allow people to keep plans that they like. Union members like to keep their union plans. Employers may offer a better plan. I think it's very much in our DNA to have choice, and so I will support that. But the other part of my plan, Jake, is to invest in and find cures in our lifetime. I don't want the debate to only be about coverage, because I think one of the best things we do as Americans is to seek and find cures. So invest in genomics, targeted therapies, and data sharing. And John Shimkus, an Illinois Republican, and I have legislation that would allow any child born into poverty to have access to their genomics so they don't have to go on a diagnostic odyssey. So already leading on this issue in the Congress, but would challenge us to go much bigger as president.
But, Congressman, with all due respect, the Medicare for All bill that you've co-sponsored would essentially do away with private health insurance, but you're saying you don't agree with it. Why are you co-sponsoring that bill?
Well, I do agree with the part of having Medicare access for anyone who wants it, because that would drive down the cost in the private insurers. It's the best bill out there that could do that right now. But being a leader means sitting down and negotiating and finding what works best for everyone. So I don't think it has to be a false choice, Jake. I think it's finding what is better than now, which now is healthcare costs are eating up our paycheck. We're in a free market system. Pre-existing conditions are not being protected by the president, and I will give the American people something better than that.
But would you vote for this bill if it came to the floor?
If this bill came to the floor, I would offer an amendment to have the public option, just as we had that opportunity back when President Obama was in, but we couldn't get it through the Senate. But this is a good start, and we shouldn't let the perfect be the enemy of the good, and I'm going to give something that's much better than what we have today.
But if that amendment didn't pass, would you vote for this bill?
Well, Jake, I think this bill, as it is better than what we have today, but I will have a public option in the law that I sign in the bill that I sign into law as president.
You've called the president and quote